pharmacology.com. So, what is pharmacology? Let us divide the word for you first. Pharma means medicine, and logos means study. Pharmacology is the study of the actions, mechanisms, uses, and adverse effects of drugs. But that will be too simple of a definition. So, we'll be discussing it further in details. A drug is an entity which can be natural or synthetic substance that alters the physiological state of a living organism. Drugs are mostly divided into two groups: medicinal drugs, which are substances used for the prevention, treatment, and diagnosis of disease, and non-medicinal drugs that are substances used for recreational purposes. These drugs include illegal substances such as cannabis, heroin, and cocaine, as well as everyday substances such as caffeine, nicotine, and alcohol. Although drugs may have a selective action, there is always a risk of adverse effects associated with the use of any drug, and the prescriber should assess the balance of desired and adverse effects when deciding which drug to prescribe. Let us talk about drug names and classification now. Well, a single drug can have a variety of names and belong to many classes. If we simplify, a drug usually has two names: brand name and generic name. The brand name of a medication is the name given by the company that makes the drug and is usually easy to say for sales and marketing purposes. The generic name, on the other hand, is the name of the active ingredient. Drugs are classified according to their four properties. First one is pharmacotherapeutic actions, which is the desired effect produced by a drug. For example, there is a hypertensive patient who needs treatment for that. Doctor prescribe him beta blocker, which will alleviate his high BP. The reduction in the blood pressure is the effect which is required, and this can be achieved by taking the drug. So, we can say it is the desired effect that is achieved by taking a drug is called as pharmacotherapeutic effect. Dose of the drug is another important parameter which determines its action. The second one is pharmacological actions. For example, beta blockers work by blocking the effects of the hormone epinephrine, which is also known as adrenaline. When drug binds to its respective receptor, it initiates a response. Beta blockers cause the heart to beat more slowly and with less force, which lowers blood pressure. This is the pharmacological action that produced by a drug. Third is molecular actions. The molecular action of a medicine is the connection of the molecular interactions between the therapeutic treatment and the biological target, for example, receptor, enzyme, that yield the physiological response. The mechanism of action includes inhibition of bacterial protein synthesis, blockage of specific biochemical pathways, etc. Lastly, what is the chemical nature of drug? Let us understand this by taking benzoic acid as an example. It contains a benzene ring and carboxylic acid. Now the properties of attachment of both these groups, either they are hydrophobic or hydrophilic, defines the chemical nature of any compound. Pharmacology deals with this domain of study as well. So, how do drugs work? There are two ways to see this phenomena: pharmacokinetic and pharmacodynamics. The word pharmacokinetics is derived from the Greek word. Pharmakon means drug and kinesis means movement. So pharmacokinetics means drug movement. Whereas pharmacodynamics is also derived from Greek word pharmakon means drug, and dynamics means power, so pharmacodynamics means drug power. Pharmacokinetics is the study of time course of drug absorption, distribution, metabolism, and excretion. Pharmacodynamics is the study of the biochemical and physiological effect of a drug and their mechanism of action and organ system, subcellular, macrocellular level. PK is the body action on the drug. Pharmacodynamics is the drug action on the body.